Sawari mo'y nag-iisa.
Lahat kanya-kanya,
Ngunit di man nagsasama.
kaya pa magkaisa.
Isa sa pag-iingat,
Isa sa ating dasal, laging nagpapatunay
na tayo'y makatao pa.
Together we are being called to make a future world. The test we face is for us to prove that we can heal as one.
Hello, I would like to start this topic by introducing myself. My name is John Aquino. I am a first-year college at Data Center Lawag. My purpose for this video was during this global pandemic, which provide a personal perspective of my experience throughout this historical event. Before we begin to the main topic, let me introduce with you what we're gonna tackle in this video. So we have here the what COVID-19 is, how COVID-19 start, the symptoms, cost, treatment, prevention, and the last part of topic which we have some question to be answered about COVID-19. To begin, the first I heard COVID-19 virus was towards the end of January 2020 here in the Philippines. Coronaviruses are a family of viruses that can cause respiratory illness in humans. They get their name corona from the many crown-like spikes on the surface of the virus. Severe acute respiratory syndrome or SARS, Middle East respiratory syndrome or MERS, and the common cold are examples of corona. I did not care that much about it because I thought it was going to be a similar situation like the Ebola virus, where you had government officials making statements about the threat of this virus. But nothing drastically changed aside from the learning of a new technique of how to properly sneeze into your elbows instead of our hand. The COVID-19 started at Wuhan, China in December 2019. The virus has since spread to all continents except Antarctica. The disease caused by the novel coronavirus causing COVID-19, subsequently named SARS-CoV-2, were first reported by officials in Wuhan City. Retrospective investigation by Chinese authorities have identified human cases with insight of symptoms in early December 2019, while some of the earliest known cases had a link to wholesale food market in Wuhan, and until that virus spread worldwide because of the trouble of people who affected with that virus. Is the treatment. There's no specific treatment for COVID-19. People who get a mild case need care to ease their symptoms, like rest, fluid, and fever control. Take over-the-counter medicine for a sore throat, body ache, and fever. But don't give aspirin to the children or teens younger than 19. Antibiotics won't help because they treat bacteria, not viruses. If you are here about the people with COVID-19 getting antibiotics, it's for an infection that came along with the disease. People with severe symptoms need to be cared for in the hospital only. Next is the prevention. Finding effects way to prevent the spreading of COVID-19 remains in a global challenge. Many viruses are preventable through antiviral vaccination. However, it takes time to develop and distribute safe and effective vaccines. A vaccine for COVID-19 is unlikely to be able anytime soon. The best way to prevent the virus from spreading is by avoiding close contact with people with COVID-19 and washing the hands regularly and use hand sanitizer at least 60%. Avoid also touching your face before washing the hands. And the best way to prevent is to stay at home, to avoid contact with another people to prevent illness from spreading. Always cover your mouth and nose when coughing or sneezing. Face masks are generally necessary for people who have the illness. Avoid close contact within about 6 feet or 2 meters with anyone who is sick or has symptoms. And this is especially important if you have a high risk serious illness. Keep in mind that some people have COVID 19 and spread it to others, even if they have COVID 19. Avoid crowds and indoor places that have poor ventilation. Avoid sharing dishes, glasses, towel, bedding, and other household items if you are sick. Clean and disinfect high-touch surfaces such as doorknobs, light switches, electronics, and counters daily. Stay home from work, school, and public areas if you're sick, unless you're going to get medical care. Avoid public transportation like taxis and ride sharing if you are sick also. If you have a chronic medical condition and may have a high risk of serious illness, check with your doctor about other ways to protect yourself. This is the question about COVID 19. What if you are planning to travel? So, if you are planning to travel, first check the WHO or World Health Organization websites for updates and advice. Be prepared to wear a face mask and face shield and use appropriate hand hygiene like alcohol when you are in public place. You may also want to talk with your doctor if you have health conditions that make you more susceptible to respiratory infections and complications. Next question is how soon after becoming infected with COVID-19 will I develop symptoms? This so-called incubation period, the time between becoming infected and showing symptoms, can range from 2 to 14 days. The average time before experiencing symptoms is 5 days. Symptoms can range in severity from very mild to severe. In about 80% of patients, COVID-19 causes only mild symptoms. Who is the most at risk for getting COVID-19? Persons are greatest risk of contacting COVID-19 are people who live in or have recently traveled to any area with ongoing active spread. People who have had close contact with a person who has a laboratory confirmed or a suspected case of the COVID-19 virus, and the people range age 60 who have pre-existing medical conditions or weak immune system. Have certain ethnic groups been harder hit by COVID-19? Yes. Many researchers have been analyzing data across the country and in some large cities, looking a number of confirmed cases and deaths based on race and ethnicity and related factors. If the persons recover from a case of COVID-19 can be infected again, the U.S. Center for Disease Control says that the immune response to COVID-19 is not yet understood because this is a new strain of coronavirus. Scientists are still collecting information and research on the virus, so it's still too early to know if you can get it a second time if you have been it once. And that's all my video. I hope you understand or you learned something from me. Bye!